Disclaimer. This podcast is for educational and informational purposes only. It is not medical advice, and it should not be used as a substitute for professional guidance, diagnosis, or treatment. Always consult with a qualified healthcare provider before starting, stopping, or changing any type of therapy, supplement, or medication. Today we are going to dive into Survodutide, one of the newer and more interesting peptide-based therapies being studied for metabolic health and weight management. Survodutide belongs to a category of compounds known as dual agonists. This means that instead of working on just one receptor in the body, it is designed to act on two. Specifically, Survodutide targets the GLP-1 receptor, which many people are familiar with from drugs like semaglutide, as well as the glucagon receptor. By combining activity at these two sites, researchers hope to create a more powerful effect on weight loss, appetite regulation, and overall energy balance. To understand why this matters, let's start with GLP-1. The GLP-1 receptor is part of the incretin system, which helps regulate blood sugar after meals. When this receptor is activated, it slows down gastric emptying, reduces appetite, and stimulates insulin release in response to food. That is one reason why GLP-1 drugs have become so popular in the treatment of type 2 diabetes and more recently obesity. On the other side, we have glucagon. Glucagon is typically thought of as the hormone that raises blood sugar by stimulating the liver to release glucose. But it also plays a role in energy expenditure and fat metabolism. By stimulating glucagon receptors, the body can increase calorie burning. Survodutide attempts to harness both pathways at the same time. Clinical trials so far suggest that Survodutide may produce more pronounced weight loss than standard GLP-1 therapies alone. Early data shows significant reductions in body weight, often exceeding what would be expected with GLP-1 receptor agonists on their own. This dual mechanism could help individuals not only control appetite, but also boost energy expenditure, which is a powerful combination. Researchers are particularly excited because this approach may work even for people who have struggled to lose weight with existing medications. Let's talk a bit about the potential mechanism in more detail. When the GLP-1 receptor is stimulated, the brain receives signals of satiety, meaning you feel full sooner and are less likely to overeat. Meanwhile, by activating glucagon receptors, Survodutide encourages the body to mobilize fat and increase energy use. In theory, this creates a synergy, less food intake combined with more calories burned. That is the reason it is being studied so closely in the context of obesity and metabolic disease. Now, what about side effects? Because Survodutide builds upon GLP-1 activity, it shares some of the same expected tolerability issues. The most common ones reported so far are nausea, vomiting, and gastrointestinal discomfort, especially in the early weeks of therapy. These symptoms usually lessen as the body adapts. The glucagon component can sometimes raise concerns about blood sugar levels, but in the clinical studies conducted so far, researchers have managed dosing carefully to balance the effects. Long-term safety data is still being collected, which is important since this peptide is relatively new. Let's place Survodutide in the bigger landscape of peptide-based therapies. Right now, peptides are becoming a central focus of modern medicine, especially in metabolic health. Drugs like semaglutide, tirzepatide, and now survodutide are showing how powerful these molecules can be in treating chronic conditions like diabetes and obesity. Unlike traditional weight loss methods that depend heavily on lifestyle changes alone, these medications directly influence the body's hormonal pathways to shift appetite and metabolism. That doesn't mean diet and exercise aren't important, but it does show how peptides can amplify and support those efforts. Some people wonder if survodutide will completely replace older GLP-1 medications. It is too early to say, but it may offer a stronger option for individuals who need greater metabolic support. On the other hand, because it acts on two receptors instead of one, it may not be suitable for every patient. That's why clinical trials are so important, to help determine who benefits the most and who may need alternative therapies. In addition to weight management, researchers are looking at whether survodutide might have benefits for liver health, especially in conditions like non-alcoholic fatty liver disease, which is tightly connected to obesity and insulin resistance. Some early studies suggest improvements in liver enzymes and fat accumulation, but again, this is still an active area of investigation. If those findings hold true, survodutide could have broader benefits beyond weight loss alone. Let's take a step back and talk about the human impact. Obesity and metabolic disease are some of the most pressing health challenges worldwide. Millions of people struggle with weight gain, blood sugar issues, and the health complications that come with them. Traditional approaches like dieting often fail in the long term because the body resists weight loss by slowing metabolism and increasing hunger signals. Peptides like survodutide aim to break through those barriers by directly modulating the hormones that control appetite and metabolism. That is a powerful shift in how medicine approaches these conditions. Of course, the conversation around peptides is not just about effectiveness, but also about access. These therapies can be expensive, and availability may be limited, depending on regulatory approvals and insurance coverage. At the same time, demand is high because of the remarkable results seen in clinical studies. Over the next few years, it will be important to watch how survodutide moves from clinical research into real-world practice and whether it becomes widely accessible. Something else to consider is how survodutide fits into personal health strategies. For example, combining peptide therapy with lifestyle choices such as balanced nutrition, physical activity, and good sleep may create even greater outcomes. Peptides should not be seen as magic fixes, but rather as powerful tools that can support long-term health when combined with other efforts. Another fascinating angle is the psychological impact of appetite regulation. Many people who have used GLP-1-based therapies report that for the first time in years, they feel free from constant hunger and cravings. If survodutide amplifies that effect while also encouraging the body to burn more energy, the mental relief could be just as transformative as the physical results. That could mean better adherence, more sustainable changes, and improved quality of life. So, where does the research stand right now? As of the most recent updates, survodutide has been in Phase 2 and Phase 3 clinical trials, showing very encouraging weight loss results compared to placebo. Some studies have reported double-digit percentage reductions in body weight over several months, which is remarkable. The safety profile continues to be monitored, but so far the balance of benefits to risks looks promising. If larger trials confirm these findings, Survodutide could represent the next generation of peptide therapy for obesity and metabolic disease. It's also worth noting that survodutide is not meant to be taken casually or without medical supervision, because it affects two powerful hormonal pathways. Careful dosing and monitoring are essential. This is why it's being studied under strict medical oversight and will only be approved for specific conditions if regulatory agencies give the green light. For anyone considering peptide therapy, the most important step is always to consult a healthcare professional who understands these compounds. Looking ahead, one exciting question is whether dual agonist peptides like survodutide are just the beginning. Researchers are already exploring triple agonists, which could target 3 different pathways at once, potentially delivering even greater benefits. The field of metabolic peptides is moving very quickly, and survodutide is a key milestone along that path. To summarize, survodutide is an experimental dual agonist peptide that activates both the GLP-1 and glucagon receptors. This dual action may create stronger weight loss and metabolic effects than GLP-1 agonists alone. Early clinical trials show very promising results, though side effects like nausea and gastrointestinal discomfort are still part of the picture. The long-term safety and full range of benefits are still being studied, but this compound represents an exciting new frontier in peptide-based therapies for obesity, diabetes, and related conditions. Disclaimer: this content is for informational purposes only and is not medical advice. Always consult with a licensed healthcare professional before making decisions about therapy, supplements, or medications. Thanks for listening, keep learning, and stay curious.